To the Healthy Built Environment for Health Professionals training series. We're excited to have Claire Graham here today to present her presentation titled Location, 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 Putting the Healthy Built Environment in Context. I'll pass the mic off to you, Claire.
Hi, thanks, Kelsey. The focus of our earlier presentations in the first round of training was really talking a lot about the content expertise of the different healthy built environment elements. The focus now is shifting a little bit to more of the process applications. How do we move these elements and ideas into practice? What are the particularly through our partnerships? And to lead off the thinking around the changes in processes for this, I've put together 5 different considerations that I'll just walk through in the presentation. Location and place, the science of complexity, the art of advocacy, the nature of change, and what evidence tells us. When we're talking about place, it's important to remember that place is not just a pin in a map, but it's a complex web of social, historical, geological, political, and cultural realities. A community built on a hillside is very different than one strung out along a long, flat highway, or one which has a very high degree of intercultural mix is very different than one that is more uniform. And so the actions and the work that we do recommending healthy built environments will change as well. Place is also a point in time. What you can do in a community last year would be very different than what you would recommend this year and what might be possible next year. So the nuance of place and time are really critical in our assessment as we put forth recommendations around healthy built environments in our different communities across the province. And the one line from my planning thesis that I thought was worth the degree was that the trouble with planning is you never get to start at the beginning. You're always building on everything that's happened in the past, the successes, the failures, the challenges, and you're also not there at the end. So it's important to recognize that flow of history that has led each community to where it is so that you can better understand the opportunities for nudging it the way you'd like it to go. The science of complexity, I'm sorry, Kelsey, this slide isn't coming up properly. Sorry.
Healthy Built Environment for Health Professionals training series. We're excited to have Claire Graham here today to present her presentation titled Location, 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 Putting Healthy Built Environment in Context. All right, I'll pass the mic off to you, Claire.
Thanks, Kelsey. In the earlier presentations, we focused a lot on the content expertise around healthy built environments, the elements that make a difference. And in this set, we'll be looking more at the processes for engagement of working with our communities. And as such, I have put together an assortment of considerations to keep in mind as we move forward with this work. The first is location and place, the science of complexity, the art of advocacy, the nature of change, and what evidence tells us. When we're talking about place, it's really important to remember that that places are not just pins in maps, but complex webs of social, historical, geological, political, and cultural realities. You simply can't recommend the same kind of solutions for the built environment in a community built on a hillside as one strung out along a long, flat highway. Similarly, one where there's been a new change in council or with different cultural mixes. It's also important to remember that place is a point in time, that what you would have recommended last year is different than what you would recommend this year, and different again from what you would recommend next year. So it's the uniqueness of time and place is important to keep in mind when we are making recommendations and applying the evidence that we have put together. The trouble with planning, and this is that you never get to start at the beginning. You're always building on what's happened in the past. And the more successful you want to be, the better you want to understand that past, the successes, the failures, the challenges, to be able to work with that to nudge our recommendations forward. And the corollary to that is you're also not there at the end, that this is part of an endless history of change in each community, and you want to make sure that you uh, leave the environment in a clean as you got it. Um, so when we talk about complexity, some of you may have seen this blobby map on the left, which is really an obesity systems map. That's the causes of obesity. And you can see that there are many, many, and they all interplay with each other to an almost incomprehensible um, diagram like this. The point is that there isn't a single solution that will solve obesity. It's not about changing the food in schools, though that's important. It's not about increasing the number of green grocers in neighborhoods, though that is also important. But each one of those interventions plays off the others in a way that makes it very difficult to say, if we do this, that will happen. Another way of describing that is that there are three types of problems: simple, complicated, and complex. A simple problem is like baking cookies. If you follow the ingredient and follow the recipe and your ingredients are standard enough, you will end up with the chocolate chip cookies you anticipated pretty much most of the time. Complicated problems are like building an airplane. It is a little bit like baking cookies in that if you follow the designs and your basic inputs are up to the right quality, you will end up with an airplane that behaves in a predictable way, and you will be able to direct it to go to Toronto or Hong Kong and so on. Complex problems are quite different. It's like raising a child. Just because you've done it once doesn't mean you know how to do it the next time. And what's interesting is when we're doing healthy built environment work, we usually end up with a range of all three. So for example, a simple problem could be arranging a meeting. So it can be quite difficult to get all the right people in the room, to know which are the right people, to have the room booked, to develop the agenda, facilitate the discussion, and do the notes afterwards. Simple does not mean easy. A complicated type problem that you might encounter in this work is organizing a 4-day international conference. It's much like organizing a meeting, but much more complicated, much more difficult to organize. A complex problem might be like trying to improve the health of seniors in 3 communities. And each community is starting from such a different point. One, the seniors are older. Another one, the seniors are more mixed ethnic background. Or one might have a dynamic senior center already built. So it becomes much more difficult to know what the right intervention is and what success would look like given how different each community is starting from. So for those of us in public health and healthcare in general, what we're used to is that an understanding of the world that the future is fairly predictable with enough knowledge and research. And the research tells us the best course of action. Cause and effect relationships are fairly simple. So when we increase the vaccination for mumps, we decrease the adverse effects from people who are infected with mumps. We know the outcomes that we want. It's fairly clear that we want to reduce mumps by X% in the general population or in a particular targeted population. And we also know that when we've done a pilot project in one area, it can be fairly easily transferred to other locations. With complex problems, the world is not fully knowable. Um, it's, but it can be influenced, and that's our job, is to influence it in the direction we want, to keep nudging it towards a more healthy environment. What makes it different is that brand new circumstances or solutions are always emerging. We have no idea what impact some of our actions will take. So for example, when you host a regional forum, you might light up a couple of mayors or councillors that take this in whole new directions and move it into the schools and move it in, start really embracing some of these concepts in ways that we had no, we couldn't have anticipated. And the actions aren't isolated. Just because we held a active transportation forum and then right afterwards council adopted separated bike lanes doesn't mean that that was caused by that. There was also built off 10 years of advocacy from the local group. There was the councillor who's been working on this for 10 years and was glad to have some backup. So basically, we the actions are all tied in, and what makes the change is the combination coming together at the right moment. And that's how you see the multiple feedback loops. Another thing which can make this a little bit more complex is that there's often multiple goals within a single initiative. So for example, when you have in food security, if you develop a community garden, it can have benefits in terms of nutrition, social connection, food literacy, what people eat out when they're buying groceries, um, all kinds of other goals. And while this makes them very powerful interventions, it sometimes can make it a bit challenging for developing your um, evaluation um, for that. A way of sort of visualizing some of this is a clock versus a flock metaphors. So with a clock metaphor, there's very defined roles and clear outcomes, and change happens in very predictable increments. And these types of problems are well suited for a project management approach where you can predict the milestones and the outcomes ahead of time. When you imagine a flock of birds or a swarm of bees, it changes things quite a bit. You're still moving many moving parts together into a comprehensive whole, but the whole structure of that is quite different. So what happens is that you don't have a clear outcome. The flock doesn't decide we are going to go to Burnaby today or we are going to fly to the lake, but they have general goals such as find food, avoid danger. And the control is very distributed. There's no one or two birds or bees that are providing the leadership. This is the whole flock moving together. And so it's very responsive to the situation. If one of the birds on the outside senses a danger, it can shift the movement. When scientists tried to replicate that behavior through robotic birds, they called them boids, they were able to mimic some of the behavior by using core values such as um, find food and avoid danger, and simple rules like stay within a couple of inches of another bird. And that, so that they don't bump in. And so that's a way of, when there is no solid control, when we're moving out of our own organizational mandate and working with others, some of that core values, being flexible to the situation, responding with simple rules about what's important, always consider health equity, those kinds of things, then we can really keep responsive to the situation and making the changes that we hope for. When we're talking about the challenges, again, there are technical and adaptive, and the technical ones are where there are known solutions. There are best practices, Implementation follows um, a predictable structure. And what's interesting is that there are usually current structures, departments, organizations that are already in place to solve those kinds of issues. And it's fairly easy to standardize. In this adaptive world where we don't know what's possible, where we have to stay flexible and the solutions fit the purpose, that new and opportunities are always emerging. And the goal isn't always able to be quantified the same way. So rather than measure the number of official community plans that we're reviewing, we start to notice that planners are adopting our language and recommendations before we even have to review those plans. And that's the change that we're hoping for. And this all comes through a process of discovery. The application implications of this for us as we do our work matters in areas of our engagement, where rather than looking for comprehensive knowledge before we act, we're looking for patterns and exploring using questions and listening and so on to develop patterns and testing ideas without owning them. Our leadership changes because rather than being able to direct and tell people what they should be doing, when we're working in partnerships, we need to nurture our relationships. We need to enhance our knowledge and support what people are doing. We need to find ways of intersecting our goals with their actions. So when we're problem solving, it helps to define the problems by type. So usually our high-level goals of improving the health in a community are then broken down into some of the projects, the perhaps complicated type problems of hosting events or putting together info briefs, or simple ones such as organizing meetings and staying responsive, very responsive to circumstance and feedback. When we're talking about planning, Eisenhower said that the verb is useful and the plan is useless. As a planner myself, I don't go quite that far, but it is really important to remember that planning is a core part of the work. And once the plan is done, that doesn't mean our work is done. It's not just the final plan. So when we started working with our first communities, we recognized that while we want to change the policies in, for example, in OCP, we just as much want to build the relationships with the staff so that ongoing issues come forward to us and that we're not finished once the OCP is done. There'll be another presentation that goes into a little bit more on advocacy, but it's important to mention here because this is where we are the act or process of supporting a cause or proposal. And that's when we have no official mandate or legislation behind us. And particularly for those in environmental health, this is quite a change, even in the opportunities and how we do our work. So when we're trying to convince and support partners to change their policies or procedures or programs, what is very helpful is knowing what's of interest to them and then finding out how that links to what is of interest to us. And once we've got that meshed together, then usually we find that we get very good uptake. And when we're thinking about the change that we're trying to create, our goal is not to submit good factual information, although we absolutely need to do that. Our goal is to create positive change, and change doesn't usually happen after a single submission. So when our recommendation resonates with other ideas, it's much more likely to be acted upon. And to be effective, again, the difference between a great idea and a highly contentious idea can sometimes be the attention to local nuances. So for example, I had the experience in one community when I suggested hosting a forum on active transportation. And the local cycling advocacy group was quite resistant because They were a highly organized group. They had done exceptional work. They knew what needed to be done next to meet their goals. And their challenge was they were having a hard time getting the financial resources to implement it. So they didn't feel like they needed that a forum would necessarily meet their goals. However, by listening to them and shifting that a little bit, we were able to change that idea to one that was um, inviting the elected folk from across the rural communities and kind of building overall support for active transportation across all the communities and sharing and learning where they've had successes and challenges, and so they can start to work together more effectively to get the resources they need. And the final point that I'm going to be making in this presentation is a few considerations about applying data to place. And what's been very helpful in the last while is we're getting more community health profiles and more local level data. And this is incredibly valuable, but it's also important to remember that it gives us a fairly good idea, for example, that if we build separated bike lanes or 3-bedroom housing units, it will have X impact. It will increase the number of cyclists or support young families. But it cannot say if that is more important than building daycares or parks. So we can't do the trade-offs, and that's where it comes back to local governments having to make those changes based on a political system talking about values. In the other data consideration, and any of you working in mid or small sized communities are well aware that the variety of small communities far outstrips the variety in large urban environments. And because of the size of the samples, we can very rarely get good enough data to really describe what's going on in those communities. That doesn't mean that the data is not helpful and that we can't use it to our advantage. But it's just important to remember that what it does is it sets us up with the right questions that we then have to test against people's experience in those communities. So if you've got any questions or you want to follow up in any way, you've got my email here, and feel free to contact me if you'd like. Thank you very much.